Hello everyone. Very good afternoon to all of you. Am I clearly visible and audible to you guys? Let me confirm it. Let me confirm if I'm clearly visible, audible. I will start the class ahead. Give me a minute to confirm. Just a second. You can give me a thumbs up in the chat box if I'm clearly visible, audible. So I hope it is working. So I welcome you all for today's session. Dr. Priyanka Sachdev here, and today I am here to continue my series of super simplified pathology. So I will decode entire Robbins in a super simplified way in this series on YouTube free lectures. So I have started general pathology. I have already started general pathology. In general pathology, we have started the first chapter, cell adaptation, cell injury. Now it's time to study cell death, the two types of the cell death. In the last lecture in the morning, I have already covered apoptosis. Those who are the students who have already attended my apoptosis lecture, or those who have missed it, they can attend the recording. It is already available on the YouTube. So you can watch the recording. So currently I am teaching you necrosis. That is a type of cell death. Let me give you an overview. So what is cell adaptation, what is cell injury and cell death as usual. So we know that in body, all the cells are in homeostasis. All the cells in the human body are in homeostasis. Can you see a cell? Of course you can see a cell. So this is a cell which is in homeostasis. What do you mean by homeostasis? Homeostasis means all the cells have specific structure, a particular structure to perform a particular function. So that a particular structure, with a particular structure, the cells of the human body perform particular function. So the cells of salivary gland do the function of secretion. Cells of the intestine do the function of absorption. Likewise, we have different cells which perform different function. They are in homeostasis. They are in homeostasis. So this is a cell, it is in homeostasis. But whenever stress is coming on on the cell, the stress can be physiological or pathological. The cell will do three things one by one. The first thing cell will do is cell adaptation. The cell will do some structural modifications inside it to overcome the stress. And there are five types of adaptations. We have already covered it. Hypertrophy, hyperplasia, atrophy, metaplasia, and dysplasia. All the adaptations are reversible. Once you remove the stress, then it will reverse back. So the first thing cell is doing is cell adaptation. But what if the stress continues? Stress still continues for a longer time. The second thing cell will do is reversible cell injury. We have already covered the various mechanisms of cell injury, the five mechanisms in yesterday's lecture. Those who have missed must watch this lecture. The five mechanisms of the cell injury and morphologically how reversible and irreversible cell injury differs. We have covered it in the last lecture, right? So again, it is reversible. As the name indicated, it is reversible. Once you remove the stress, it will be reversible to the normal cell. But what if the stress still continues? If the stress still continues, the last thing which happens is irreversible cell injury. What is irreversible cell injury? Irreversible cell injury is the other name given to the cell death. So basically, cell dies. The cell is ultimately dies. The cell is ultimately dead. Now there are two ways by which cell can be dead. There are two ways: apoptosis and necrosis. So what is the difference between them? In my last lecture in the morning, I have already covered apoptosis. So till now, we have covered the first chapter, cell adaptation. We have covered reversible injury, the mechanism of the cell injury. And from the irreversible cell injury, that is cell death, we have already covered apoptosis. Last topic of this lecture is this series, is first chapter is necrosis. So let me start with necrosis. This is a table of the various types of cell adaptations we have already covered in the last lecture. So those who have missed, please watch the recording of cell adaptations available on the YouTube. It is my lecture only. So you can watch the lecture and see the various types of cell adaptations: hyperplasia, hypertrophy, atrophy, metaplasia, dysplasia. We have already covered the various types of cell injury, the differences between reversible and irreversible cell injury. It is also available. Now let me teach you cell death. In the last lecture, we have covered apoptosis, and now I am starting with necrosis. Are you people there? Should I start with necrosis? Should I start with necrosis? So what is necrosis? What is necrosis? What is the definition of necrosis? Necrosis is a type of cell death. Actually, it is not a death of one single cell. It is a death of cluster of cells in living animal. So in any living organism, if a cluster of cells are dying, it is necrosis. So when the cell death occurs, the cell will burst. The cytoplasm will come out. The cell will burst. The cell will be the dead. The cytoplasm will come out, and the cell will be degraded by the hydrolytic enzymes. Hydrolytic enzymes will come and cause the degradation. So that is the definition of necrosis. Now, the difference between apoptosis and necrosis. We have already seen apoptosis in the last lecture, and now I am teaching you necrosis. Apoptosis and necrosis both are type of cell death. I have already taught you in the last lecture, apoptosis occur of a single cell. But necrosis never occurs of a single cell. It occurs of a group of cell or contiguous cell. Apoptosis is an active process in which for doing apoptosis, cell require ATP, but necrosis is a passive process. For doing necrosis, cell is the ATP is not required, energy is not required. Apoptosis is always, it can be physiological also, it can be pathological also. In the last lecture, I have given you the examples of physiological apoptosis, embryogenesis and others, and there are few examples of pathological apoptosis, but necrosis is always pathological. If necrosis is occurring in any part of human body, it is a disease. Necrosis means disease. It is not normal. It is never physiological. It is always pathological, right? So in apoptosis, the cell is not bursting. The cell is not bursting. This is a cell. The cell membrane is remaining intact till end. So cell membrane is intact. Cell membrane, plasma membrane is intact towards end, till end. It never burst. But in necrosis, the cell membrane burst. So cell membrane have disruption. It burst. It just burst. It is having disruptions. So cell membrane disruptions are present. So since here the cell membrane is intact, there is no leakage of cytoplasm. And since there is no leakage of cytoplasm, there is no inflammation. But in necrosis, in contrast to apoptosis, since the cell membrane disruption is there, there is leakage of cytoplasm outside. Since cytoplasm leaks out, so the cell membrane disrupts. Now compare the two cells. Compare this cell, compare this cell, this one, it is intact and this one is disrupted. So here cytoplasm leaks out. So due to the leakage, there is inflammation. There is inflammation. So inflammation is a feature of necrosis. There is no necrosis without inflammation. Inflammation is a hallmark feature of necrosis. Have you got it? These are the differences you can understand. So the same thing is written in front of you. You can read for necrosis, a group of cells is affected. It is not in contrast to apoptosis, which occurs in a single cell. If you talk about necrosis, inflammation always present in necrosis, in contrast to apoptosis, where inflammation is absent. Have you got it? Give me a thumbs up if you got these differences. Now let me tell you the various types of necrosis. Let me teach you the various types of necrosis. So necrosis is basically of 5 types. It should be at the tip of your tongue. Whether you are preparing for your university exams of pathology or whether you are preparing for any competitive exam, NEET, PG, FMG, INICT next. The types of necrosis should be known to you. It is a very ultra important question. There are 5 types of necrosis. The mnemonic is triple C double F. So CCCFF. Coagulative necrosis, number 1. Collicative necrosis, number 2. Collicative is also known as liquefactive. Collicative is also known as liquefactive. The third is caseous necrosis. The third is the caseous necrosis. Fourth is fat necrosis. And fifth is fibrinoid. So I am going to teach you all 5 necrosis in detail. So I suggest you to make this table with me. So please everyone take a notebook, take a pen and please start making this table with me. The comparative table between the 5 type of necrosis. Please make 5 columns. And please write the name of the necrosis. It is coagulative necrosis, the first one, collicative or also known as liquefactive, the second one, caseous, the first one. So the 3 C's are done. It is coagulative, collicative and caseous. Then 2F, fibrinoid and fat. Fibrinoid and fat. So these are the 5 type of necrosis. So what in this table basically I am going to teach you. In this table first I will teach you the definition. What is the difference? Now in all of them cell death is there. These are all necrosis. Necrosis means cell death. You will ask me, ma'am, why there is 5 type of cell death? Ultimately, the cell is dying now. So the cause is different in all of the 5. The cause is different. The cause is different in all 5. So I will tell you the causes of different type of necrosis. Ultimately, the cell will die. I agree. But the pattern of dying is different. The pattern of dying is different. So there are 5 type of necrosis. So tell me the definition of all, tell me the causes of each of them, tell me the gross appearance, tell me the microscopy. In the microscopy, I suggest you to make the diagrams of the 5 type of necrosis. Everyone give me a thumbs up. Have you got it? Please everyone give me a thumbs up. Please everyone give me a thumbs up. Should I proceed ahead? Should I proceed ahead? So these are the 5 type of necrosis are in front of you. So before starting the differences between the 5 type of necrosis in this table, I would like to tell you some details, right? So can you see a cell? Can you identify which cell it is? In human body, we have many type of cells. We have neurons which are present in brain. We have RBCs, we have WBCs, we have various types of WBCs, neutrophils, eosinophils, we have muscle cell, we have heart cell. So various cells are there. You can see few cells are shown in this diagram. It is a muscle cell, intestinal cell, fat cell, neuron, RBC, WBC, monocyte, lymphocyte, basophil, neutrophil. So how you identify which cell it is? We identify any cell by three details. There are three details given in any cell. Number one, the outline of the cell. Outline means shape. Can you see all these cells have different shapes? They all have different shapes or different outlines. The outline or shape is known as architecture of the cell. It is known as architecture. So in teaching you the definitions of the five type of necrosis, I will use the word architectural detail. By architectural detail, architectural detail, I mean the shape of the cell, the outline of the cell. I mean shape or outline of the cell. That is the detail. That is the first detail given in the cell. The second detail, see the color of the cytoplasm in all these cells. This is pink, this is less pink, this is yellow, this is blue. So the color of cytoplasm is different. Some of the cytoplasm are granular. Can you see? Some of them are non-granular. Some of them. So the second detail is cytoplasmic detail. The second detail is cytoplasmic detail. So cytoplasmic detail mein what is the color of the cytoplasm, whether the cytoplasm have granules, yes or no. So that is the second detail. And the third detail, see the nucleus of all. So nucleus is single lobated, multiple lobated, nucleus is circular, oval, it is bilobated. So what is the shape of the nucleus? What is the color of the nucleus? So that is known as nuclear detail. So there are three details in a cell. What are the three details in a cell? What is the architectural detail, what is the cytoplasmic detail, what is the nuclear detail? That is, what is the shape of the cell, outline of the cell, what is the color and granules of the cytoplasm, what is the shape and color of the nucleus. Based on the three information, we can identify what cell it is. I want thumbs up from everyone. So based on that, we can do the identification of a cell. Everyone give me a thumbs up, please, come on, if you got this point. So if you got this point, it will be easy for you guys to understand the definition of the five type of necrosis. Now you are ready for understanding the definition. First, give me a thumbs up. So these are the various details which we should notice in a cell to identify a cell. For identification of a cell, we require three details: architectural detail, cytoplasmic detail, and nuclear detail. Based on these three details, we will do the identification of a cell. Give me a thumbs up. Give me a thumbs up. Okay. So let me start with the first type of necrosis. Start filling this table with me. So I will teach you four things in coagulative necrosis. What is the definition? What are the causes? What is the gross? What is the microscopy? Then coagulative necrosis is done from my side, right? So what is it? What is it? Coagulative necrosis. Okay, Rishinika, you got it. Very good. So these are the three details. Listen, in coagulative necrosis, the cell is dying. Of course, it is necrosis means cell death is there. During the cell death, the architectural detail is persisting. The architectural detail is persisting, but cytoplasmic and nuclear details are lost. So cell is dead. So we can see only outline. But inside the outline, there is the cytoplasmic detail is lost, the nuclear detail is lost. So still we can identify the cell. Still we can identify the cell that is in coagulative necrosis out of the three details: architecture, cytoplasmic, and nuclear. Architectural detail is persisting, but cytoplasmic and nuclear details are lost. Have you got it? Cytoplasmic and nuclear details are lost. Because architecture means outline is persisting, still we can identify the cell. That is the coagulative necrosis. So what is it? Out of the five type of necrosis, I'm going to teach you five: coagulative, colligative, caseous, fibrinoid, and fat. The five type of necrosis. The first one, this one, coagulative, is the most common among the five. So write down in the introduction that it is the most common among the five. The first thing you have to write down this. Among the five type of necrosis, it is the most common necrosis, right? What is the definition? Architectural outline persists, but cytoplasmic and nuclear details are lost. So still we have architectural detail, right? So see this diagram. Everyone see this diagram. So these are alive cells. Now see the outline of this cell, see the cytoplasm color, and see the nucleus color. So it is having all three detail: architecture, cytoplasmic, nuclear. All three details are present in a alive cell. Now the cell is dead. This cell is dead. A cluster of cells is dead. It is not a single cell. A cluster of cells are dead by coagulative necrosis. They are dead. Now see the outline. See the outline. Outline is exactly same. If you compare the outline, it is exactly same. So architectural details are persisting. They are exactly same. But see the color of the cytoplasm and color of the nucleus. So cytoplasmic color is changed. It is somewhat changed or lost. And nucleus is also, it become pycnotic, it become karyoraxis, it become fragmented, it is lost. So cytoplasmic and nuclear details are lost. So that is the definition of coagulative necrosis. I again want a thumbs up from you guys. Have you got it? So what is the definition of coagulative necrosis? In coagulative necrosis, basically the architectural detail are persisting, but cytoplasmic and nuclear details are lost. That is the definition of coagulative necrosis. Give me a thumbs up. Rishinika, others? I can't see the names of others. Give me a thumbs up. You got the definition? You got the definition? Give me a thumbs up. Come on. So that is the thing. That is the thing. Now listen. What is a ghost? Have you heard the term ghost? Ghost का मतलब क्या होता है? Ghost का मतलब होता है in Hindi it is known as bhoot. So how does a ghost look like? Have you ever seen a ghost? I have not seen. I don't believe in that. Anyways, how does a ghost look like? So ghost is someone who is only having an outline, who don't have details inside. So we can see the outline only. We can't see the details inside. That's why coagulative necrosis में the cells are known as ghost cells. These cells in coagulative necrosis, these cells are known as ghost cells because they only have outline. They don't have inside detail. They don't have cytoplasmic detail. They don't have nuclear detail. That's why they are known as ghost cell. Number one. Number one. This is the nomenclature given to them. One more thing I would like to tell you here. Have you heard the term tombstone? What is a tombstone? Tombstone. Have you heard it? What is the dictionary meaning of tombstone? It is a stone which is present over the graveyard. ग्रेवयार्ड के ऊपर एक स्टोन रखते हैं ना. हैव यू हर्ड दिस टर्म? ओके, लेट मी शो यू द tombstone. This is a tombstone. So can you see the diagram of a tombstone? This stone which is present over the graveyard, it is known as tombstone. This stone is known as tombstone. Now what does this stone look like? It only have outline. I can see the outline of the stone, but inside the stone I can't see nothing. I can see nothing. So there is no structural detail. Inside detail absent. That's why it is known as tombstone appearance. Tombstone appearance. Tombstone. It is a stone which is present over the graveyard. Yes, Rishinika. So it is memorial like. So the cells are also known as tombstone cells. Tombstone cells. The meaning is same. The meaning of ghost cell or tombstone cell is same. That is only outline is present. Nothing else is present. Inside details are lost. Cytoplasmic detail is lost. Nuclear detail is lost. Only outline is present. That's why coagulative necrosis may the cells which are formed in coagulative necrosis are known as ghost cell or tombstone cell. Give me a thumbs up. So the definition is over. So still, because the architecture is persisting, we can recognize the cell. We can identify the cell. Give me a thumbs up. So the summary is that what is coagulative necrosis? In coagulative necrosis, it is a necrosis in which architectural detail are still persisting, but cytoplasmic and nuclear details are lost. That's why we can see only the outline of the cell. Because the outline is still present, we can identify the cell. Still, we can identify the cell, which cell it is. It is a muscle cell, heart cell, it is a RBC, WBC. We can identify from the outline, right? Since only outline is present, nothing else is present. That's why these cells, the coagulative necrosis cells, are known as tombstone cells, or these are known as ghost cell. I want thumbs up again. Have you got the definition? So this is the definition. Rishinika, Dr. Logical. Have you got the explanation? That is the introduction. Now coming on the causes. What are the causes of coagulative necrosis? You know, human body is made up of multiple organs. From head to toe, we are made up of organs. Of course, we are made up of organs. Our organs are made up of cells. Our organs are made up of cell. Let me draw few organs. So we have heart, we have lungs, we have multiple organs. We have multiple organs. All organs have a blood supply. All the organs in the body receive blood, receive pure blood from the aorta, from the arteries. All organs throughout the body, we have blood. Have you ever imagined if any part do not get the blood? That is ischemia. That is ischemia of any part of human body. Ischemia. Ischemia means it is not receiving proper blood. Ischemia and hypoxia. What will happen? We have studied that organ. The cell of that organ will die. The cell of that organ will die by coagulative necrosis. Coagulative necrosis. So ischemia of any organ of human body will lead to death of that organ cell by coagulative necrosis, but there is an exception. Let me draw a human body again. So there are multiple organs inside the human body, right? So you can see these are the lungs, this is heart, this is brain, this is the complete GIT, stomach, intestine, bone, muscles. We have multiple organs. If ischemia occurs of any organ of these not getting the blood, the cells of that organ will die by coagulative necrosis. Exception is the brain. Brain is the exception. If brain do not get blood, the brain cell will also die. I'm not saying it is not dying. It will also die. But brain cell will not die of coagulative necrosis. Brain cell will die of second necrosis, that is liquefactive. Liquefactive of or colligative. So the summary is that ischemia of any organ will lead to necrosis. So ischemia of all organ is one side of, and ischemia of brain is on other side. Have you got it? So ischemia of all organ, the cells of that organ will be dead by coagulative necrosis. But ischemia of brain, the cells of the brain will be dead by liquefactive necrosis or colligative necrosis, one and the same thing, not coagulative. So brain is the exception. Give me a thumbs up. Now you will never forget. It is the most important MCQ or PYQ repeated many times in your exam. Give me a thumbs up. So the first cause is ischemia. Can you see it is written? Ischemia of all organs except brain will cause the death of cells of that organ by coagulative necrosis. Number one, if we have burns anywhere, so burns can be local, it can be generalized throughout the body. So burns mean that area, the cell of that area will be dead. If I'm having a burn here, anywhere on the human body part, so the cells of that area will be dead by coagulative necrosis. So thermal injury leads to coagulative necrosis. Number two example. And number three, it is Zenker's degeneration necrosis. It is an example of degeneration, Zenker's degeneration, right? So three causes I have taught you. So definition is done. Three causes are done. Number one is ischemia of all organ except brain. Number two, thermal injury. And number three, Zenker's degeneration. Coming on gross. How does grossly coagulative necrosis looks like? Can you see a diagram of liver? You can see, of course. So can you see a part of this liver? It is showing coagulative necrosis. So this part is pale. You agree? It is firm and it is swollen. So pale, firm and swollen. That is the morphology, right? Here you can see a spleen. Can you see a spleen? Of course you can see. In the spleen, this portion is showing coagulative necrosis. So again, this portion is pale, it is yellow and it is swollen. So that is the gross. Again, you can see the same in the kidney. Can you see? This is a kidney. This is a portion of coagulative necrosis in the kidney. Again, the three things. What are the three things here? It is pale, it is swollen and it is firm. So that is the gross appearance. Nothing important. Coming on microscopy, if I cut this kidney, if I cut it and make a slide of it, how does the slide will look? So this is the slide. This is the slide of a kidney. Now coagulative necrosis can occur in any part except brain. In brain, coagulative necrosis nahi hoga. It will never occur in brain. But in any part, coagulative necrosis can occur. But here I cannot draw the diagram of every part. I have drawn the diagram of kidney to explain you coagulative necrosis. Now see, this side, this is normal kidney. This kidney is normal kidney and this side it is coagulative necrotic kidney, and at the junction of the two there is inflammation. There is inflammation in the normal kidney. Can you see the tubules? These are the cells of the tubules. See the cells of the tubules, see the nucleus inside them. They all have nucleus. They have outline and they have nucleus inside them. They have cytoplasm, they have nucleus. So all three details are present normally. So they have outline, they have cytoplasm, they have nucleus. All three details are present in the cells of the normal kidney. But see the cells on the other way around. See the cells here. I can see only outline. I can see only outline. Only outline is present. The cytoplasmic detail is lost and the nucleus is pycnotic. The nuclear details is also lost. So only outline. Now compare it. Only outline is persisting. So it is coagulative necrosis. Give me a thumbs up. And at the junction, now all five necroses have inflammation. As I have told you, necrosis cannot occur without inflammation. Inflammation is the hallmark of necrosis, which differentiate necrosis from apoptosis. So at the junction of the two kidney, the viable kidney and the coagulative necrotic kidney, you can see a cluster of lymphocytes. So all these cells are lymphocytes. Can you appreciate? These all are lymphocytes. ये जो junction पे सारे cells हैं, these all cells are lymphocytes. That is showing the inflammation at the junction. Give me a thumbs up. So these cells, in the coagulative necrosis, see the cells. You can see only outline here. We can see only outline. We can't see cytoplasmic detail. We can't see nuclear detail. So these cells are known as tombstone or ghost. So here the cells are tombstone. Tombstone, that is the hallmark. That is, we can see only outline of the cell. That is retained. That is retained. So we can still identify the type of the cell. But cytoplasmic and nuclear details are lost. So that is the only microscopy, and at the junction, we can see the inflammatory cell. The inflammatory cell, that's it. That's it. So we are done with the first coagulative necrosis. With the first coagulative necrosis, we are done. Everyone give me a thumbs up. Coagulative necrosis, which is the most common necrosis among the 5 types of necrosis, we are done with it. Can you help me in filling the table? In the end, we will fill the table otherwise. You want me to fill the table? In the end, we will, okay. We will revise it. Just a second. So, coagulative necrosis, liquefactive necrosis, that is colligative. The second one, liquefactive or colligative, I am coming on that. The third one is caseous. The fourth one is fibrinoid. And the fifth one is the fat. So, these are the 5 types of necrosis that you have to study. So, tell me the introduction, that is definition of coagulative. Tell me 3 causes of coagulative. Tell me the gross appearance of coagulative and tell me the important points in microscopy of coagulative. Does anyone want to participate? Anyone? Rishinika, what is the introduction? What is the definition of coagulative? I've already told you, no? What is the definition here? Just a second, let me see your chat. What is the definition here? Anyone? So in the introduction, you have to tell me here architectural detail is persisting, but cytoplasmic and nuclear details are lost. Yes, and it is the most common one. In the introduction, write down it is the most common among the 5. What are the 3 causes? What are the 3 causes here? What are the most common causes? Ischemia of all organs except brain. Don't forget the exception brain. Don't forget the exception brain. That is ischemia of all organs except brain. Number 1. The second is thermal injury. And third is Zanker's degeneration. What is the gross? What is the gross? The organ will turn pale, yellow, and swollen and firm. Microscopy, the cell will look like tombstone. That is the same thing. Outline persists, but cytoplasmic and nuclear details are lost. Very good, Rishinika. Coming on the second type, that is liquefactive necrosis. These 4 headings only I am going to teach you in liquefactive necrosis now. So let me start liquefactive necrosis. The second type of necrosis is liquefactive necrosis, also known as colligative necrosis. Liquefactive or colligative necrosis. So let me start liquefactive or colligative necrosis. Now see what is the difference here. Now if I talk about coagulative necrosis and if I talk about liquefactive necrosis. So if I compare the two necrosis together, listen. So architectural detail, cytoplasmic detail, nuclear detail. What was there in coagulative? In coagulative, the architectural detail persists, but cytoplasmic and nuclear are lost, as I have already told you. But in liquefactive, all 3 details are lost. So cell will disappear. There is no outline of the cell. There is no cytoplasm of the cell. There is no nucleus of the cell. Cell will disappear. And instead of cell, we have a semi-liquid material, semi-fluid material. That's why known as liquefactive necrosis. Everyone gave me a thumbs up if you got the definition, if you got the comparative analysis between the two. So that is the introduction, liquefactive necrosis. I will tell you the causes, gross and microscopy now. So in the introduction, please see what I have written. Please see here the architectural detail as well as cytoplasmic detail as well as nuclear detail. All 3 details are lost and entire cell got converted into a semi-fluid material. So entire, can you see these are the cluster of alive cells? See the architecture, see the cytoplasm and see the nucleus in the alive cell. This is a cluster of liquefactive. It is converted into liquefactive necrosis. Where is the cell? Where is the architecture? Where is the cytoplasm? Where is the nucleus? So all 3 details are lost. And instead of it, we are getting a semi-fluid material here. That is a liquid material. That's why known as liquefactive necrosis. Give me a thumbs up. Now do the comparison. Everyone, please do the comparison. Can you see these alive cells? Alive cells. Here, all 3 details are present. But in coagulative necrosis and liquefactive necrosis, compare. Here, architecture persists, but cytoplasm and nucleus is lost. And here, all 3 are lost. All 3 are lost. But the cell is converted into semi-fluid. Into a semi-fluid. I want thumbs up. I want thumbs up. Have you got it? So that is the definition. No one will explain you with such a crystal clear concept. Everyone give me a thumbs up. Everyone give me a thumbs up. This is the definition of coagulative necrosis and this is the definition of liquefactive necrosis. Give me a thumbs up. Have you got it? Have you got it? What are the causes? What are the causes? One cause you already know, ischemia of the brain. Ischemia of all organs leads to coagulative necrosis, but ischemia of brain leads to liquefactive necrosis. Give me a thumbs up. So see, this is the definition of coagulative and this is the example. This is the definition of liquefactive and this is the example. That is ischemia of the brain. So one example is ischemia of the brain. Ischemia of the brain is the example of liquefactive necrosis. Now imagine human body. In human body, there are multiple organs as we know. If any organ is infected by a bacteria, so say any organ. So inside human body, these all multiple organs, we are having multiple organs. If bacteria is invading any organ and forming pus, pyogenic bacteria, forming pus in that organ, causing the infection in that organ. So that organ, the cells of that organ will be dead by liquefactive necrosis. Liquefactive. So infections, pyogenic bacterial infections lead to liquefactive necrosis. So the 2 examples are ischemia of the brain and infection. Infection by pyogenic bacterial infections. That is the thing. That is the thing. So gross appearance, nothing important is there. Here the entire organ, the cluster of the cells undergo a semi-liquid, a liquid material. So this is a liquid. Can you see a liquid filled in a cyst? So a cyst cavity, a cystic cavity is formed with a liquefied center. So that is the gross. It is not pale. It is not swollen. It is not yellow like the previous one. It is a liquid. And the liquid is binded by a cyst capillary, cyst wall, cystic capillary. Give me a thumb, cystic cavity. Coming on the microscopy. Now, can you see this is a diagram of the brain? You can see brain ke andar hai because it most commonly occurs in ischemia of brain. If I cut this brain and make a slide, so this is the slide of the brain, microscopy. What does it is looking like? So here, this is normal brain. This all is normal brain. And this all is liquefactive necrosis brain. And at the junction, you can see the inflammation. At the junction, you can see the inflammation. Now, in the normal brain, please everyone appreciate these are the neurons. These are oligodendrocytes. These are the cells of the brain. The background is fibrillary. It is normal fibrillary background which we have in the CNS. So in the CNS, this is a normal. It is absolutely normal. Now see on the other way around. Now what it is converted into? It is converted into this. So you will see, ma'am, where is the cell? Where is the cytoplasm? Where is the nucleus? Where is the outline? Everything is lost. I can't see even a single cell. I can see only what it is. What it is? It is liquid material. It is liquid. Semi-liquid material is there. So semi-liquid cell debris are there. Cell debris are there. It is liquefied. So it is known as liquefied necrosis. But at the junction, you can see the inflammation. Now in coagulative necrosis at the junction, we can see only lymphocyte. Inflammation was simple and it was only lymphocyte. Here in inflammation, we are getting number one lymphocytes. So hey, lymphocytes are present. Along with lymphocytes, few macrophages are present, few plasma cells are present, and we have blood capillaries. These are the blood capillaries at the inflammation. And these are forming cyst wall. It is forming granulation tissue or the cyst wall. Give me a thumbs up. You got it. So that is the second type of necrosis we have done. We have done coagulative necrosis. We have done liquefactive or coagulative necrosis. I hope you know the definition of both. You know the causes of both. You know the gross. You know the microscopic diagram. Here I have shown you diagram of kidney. Here I have shown you diagram of brain. In kidney and brain, both of them, on one side I have shown you normal, alive kidney and brain, and on other side I have shown you the dead, necrotic kidney and brain, and at the junction I have shown you the inflammation. Because out of the 5 necrosis, none of the necrosis is without inflammation. All necrosis, inflammation is a part of necrosis. Give me a thumbs up. Should I come on the third type of necrosis? Should I come on the third type of necrosis? The third type of necrosis is caseous necrosis. Let me start caseous necrosis. Now, why the caseous is known as caseous? Caseous is known because the Greek meaning caseous is cheese. It looks like cheese. Have you ever seen cheese at your home? Yes, of course you may have seen. This is cheese. How does cheese look like? Cheese is dry. It is whitish, yellowish or yellowish. It is dry and it is granular. It is granular in appearance. So dry, granular, whitish, yellowish appearance is cheese-like appearance. Now, because of caseous necrosis in the organ, just a second. The organ, can you see the lung? Inside the lung, this is the caseous necrosis. It is looking like cheese. It is looking like cheese, means it is looking dry, it is looking white or yellow, it is looking granular. So that is cheese-like appearance, granular. Give me a thumbs up. So that's why it is known as caseous necrosis. So it is known as caseous because it resembles cottage cheese. The necrotic area resembles the cheese. That's why known as caseous. So it is homogeneous granular mass resembling a cheese, a cottage cheese. Now what is the definition here? Let me compare the definition. Let me take the 3 necrosis together. This is coagulative necrosis, the first one. This is liquefactive or colligative necrosis, the second one. C. And the third C is caseous necrosis, the third one. Everyone please concentrate here. So the 3 type of details I am telling you. Architectural detail, cytoplasmic detail, nuclear detail. Right? You will tell me what is there. So in coagulative necrosis, the architectural detail persists, but cytoplasmic and nuclear details are lost. Are you agree? Give me a thumbs up if you are agree. Give me a thumbs up if you are agree. Yes, Rishinika, Amudha, anyone else? Give me a thumbs up. Dr. Logical, give me a thumbs up. You got it? Are you agree with me? So in just a second, let me see if I can see your chat. Yeah. So in coagulative necrosis, architectural detail persists, but other 2 details are lost. In liquefactive necrosis, all 3 details are lost. In caseous necrosis also, all 3 details are lost. So you should ask me a question, ma'am, what is the difference between liquefactive and caseous then? If all 3 details are lost in both of them, what is the difference between them? The difference is that here the cell is not lost. Architecture persists, so you can identify the cell. Right? Here the cell is lost. Entire cell is lost. Even not outline is present. And instead of the cell, we have a liquid material, a semi-liquid or liquid material. Because here the cell debris are liquefied. Here entire cell is converted into a granular material, into granular debris, granular dry debris, ... It is not liquid. So that is the difference. Have you got it? Which granular debris look like cheese. That's why it is known as caseous. And here the cell converted into a semi-liquid. That's why known as liquefactive necrosis. That is the reason why we are calling them. And here cell is not lost. It is not lost. It is not replaced. Cell is still present. It is like ghost cell. It is known as ghost or tombstone. One and the same thing. I cannot simplify than this. These are the limits. So I am super simplifying the pathology for you. In the most simplified manner, I am putting it in front of you. Give me a thumbs up if you got the differences between the three type of necrosis. So read the definition of caseous. The third type, caseous. Now read the definition, introduction, write down the introduction, write down the definition in the introduction. So why it is known as caseous? Because in this necrosis, homogeneous granular mass is formed which looks like cottage cheese. That's why it is known as caseous. Here architectural details as well as cytoplasmic detail as well as the nuclear details all are lost, and entire cell is converted into amorphous granular debris. Amorphous granular debris which look like the cheese. That is the introduction. That is the introduction. Now see this diagram. It is a cluster of alive cell. In the cluster of the alive cell, notice the three things: architecture, cytoplasm, and nucleus. And it is converted into caseous necrosis. So it is converted into amorphous debris. Can you see? It is converted into amorphous debris. It is converted into amorphous debris. Amorphous granular debris. It is not liquid. Now compare the three. Compare the three. This is first, this is second, this is third. You can see it is coagulative necrosis, it is liquefactive necrosis, and it is caseous necrosis. Now tell me the definition. Here, see the diagram. See the diagram, see the diagram, see the diagram. So cluster of alive cell, alive cell, alive cell. Here a cluster of alive cell got converted into the cell where outline still persists, but the cytoplasmic and nuclear details are lost. Here entire cell is lost. Here also entire cell is lost. But here it is converted into a liquid material, and here it is converted into a granular amorphous material. Give me a thumbs up. Everyone give me a thumbs up. So let me write the definition. Here architecture persists, but nucleus and cytoplasmic detail are lost. Here architecture, cytoplasmic, nuclear, architecture, cytoplasmic, nuclear, all details are lost. Here also, here also. But here the cell is converted into liquid, and here the cell is converted into amorphous, granular amorphous debris. Give me a thumbs up. Give me a thumbs up. So till now, I have explained you the examples of coagulative. The three examples: ischemia of all organ except brain, and ischemia of brain occurs here. Ischemia of all organs occurs here. Ischemia of brain occurs here. Right? One example. दूसरा example है यहाँ पे thermal injury. और तीसरा example है Zanker's degeneration. Right? Here only two examples are there. One is ischemia of brain, and second is pyogenic bacterial infection. What are the causes of caseous? There are four causes of caseous, four organisms: two bacteria, two fungus. What are the two bacteria? It is TB and syphilis. Infection by the TB and syphilis leads to caseous necrosis, number one, and two fungus, coccidiomycosis and histoplasmosis. So two bacteria, Mycobacterium TB and syphilis, and two fungus, histoplasma and coccidiomycosis. Total four causes of caseous necrosis. Now please do a comparative analysis. I want thumbs up from everyone. I want thumbs up from everyone. Should I come on the fourth? Should I come on the microscopy, gross and microscopy appearance of caseous necrosis before coming on the next? Should I come? Okay, I will. So this is the gross appearance. Grossly, this is the lung. Inside the lung, this is TB. TB occurs in the lung. So can you see TB is looking like dry cheese? It is soft, granular and yellowish. It is looking like a dry cheese, right? Now, you should ask me, ma'am, why here the granular debris are formed? The granular debris are formed because of the cell wall of the bacteria. The cell of the wall of the bacteria contains mycolic acid. That is giving the granularity. In the cell wall of the bacteria, a lipopolysaccharide is present. That is giving the granular appearance, the cheesy appearance. That is the thing. Now microscopy, if I cut it and make a slide of it, this is the slide. In this diagram, identify the organ. First, identify the organ. It is a slide of which organ? It is a lymph node. It is a lymph node. As usual, on one side, this is the normal lymph node. On other side, this is caseous necrosis. And at the junction of the two, there is inflammation. There is inflammation. Can you notice? So here a lymph node is shown. So TB occurs in lymph nodes also. We know. So normal lymph nodes, can you see the normal lymph nodes? So in the normal lymph nodes, the lymphocytes are present. The blue color cells are the lymphocytes. They are present in the form of the follicle. So it is a normal lymph node. See the architecture of the lymphocyte, the nucleus of the lymphocyte, the cytoplasm of the lymphocyte. So lymphocyte is absolutely normal this side. But on the other way around, see this. It is converted into this. So you will see, ma'am, where is the cell? I can't see even a single cell. No architecture, no cytoplasm, and no nucleus. So entire cells are converted into debris, the granular amorphous debris, right? So that is caseous necrosis. But please notice the junction. At the junction, inflammation is present, but this inflammation is not normal inflammation. In the first coagulative necrosis, we find only lymphocyte. In the second liquefactive necrosis, along with lymphocyte, we found macrophages, plasma cell with capillaries, which is forming the cyst wall. That is the second type. In the third type, that is caseous necrosis, we are having a special inflammation, that is granuloma. In the inflammation, granuloma is formed. You know what is granuloma? In the granuloma, we have a giant cell. See, appreciate the giant cells here. They have multiple nucleus. These are the giant cells. Can you see the giant cells here? So this is the giant cells, and these all cells, apart from giant cells, the oval shape cells, the oval shape cells, these are epithelioid cells. So these all are epithelioid cells. So at the junction, we have a granuloma. That's it. See, this is a normal lymph node. Till now, we have done the three type of necrosis: coagulative necrosis, liquefactive necrosis, and caseous necrosis. Everyone gave me a thumbs up. Everyone. Should I come on the fourth necrosis, the fat necrosis? Uh, okay. Okay, Sufyan said, thanks for your compliment. Stay connected. So, okay, if you want any other topic from pathology to be taken by me on the YouTube, the free classes, please, you can tell me the name of the topics. I will try to cover them on YouTube classes. Thanks for the feedback anyways. So let me tell you the next two type of necrosis. Till now, we have covered the first three type of necrosis. In the end, we will make a comparative table of all five necrosis, right? Let me come on the fourth type of necrosis, the fat necrosis. The fat necrosis. Let me come on the fourth type of necrosis, fat necrosis. In human body, in entire human body, tell me where is abundant of fat is present. Abundant of fat is present where? There are three locations in human body, 1, 2, 3, where abundant of fat is present. Number one, in the omentum. In the omentum, you know, in the intestine, over the intestine we have a omental covering. In the omentum, in omentum or peritoneum. Number one, peritoneal covering or omental covering. Number two, inside the pancreas. Inside the pancreas, we have abundant fat. And number three, breast of female, not male. Female breast have abundant fat. So these are the three locations inside the human body. It is the female breast, it is the pancreas, and it is the omentum. So these are the three organs which have abundant of fat. If infection or trauma, infection, inflammation, or trauma occurs of any of these, so the cell death inside these organisms is known as fat necrosis. The cells of these organs having abundant adipose tissue. The fat is adipose tissue. They are having adipose cells. Adipose cells. So adipose cell will die by fat necrosis. So either omentum में inflammation is there or omentitis. Pancreas में pancreatitis, acute pancreatitis, or breast में usually trauma or mastitis. So either inflammation, infection, or trauma of these three organs lead to fat necrosis. So basically, what is fat necrosis? What is fat necrosis? Tell me the definition. In fat necrosis, the fat-rich anatomical locations of the body. What are the three fat-rich anatomical locations of the body? It is female breast, it is pancreas, and it is omentum. So death occurs in that either due to trauma or due to infection. So death of the adipose tissue is known as fat necrosis basically. So that is the definition. What are the causes? I have already told you the causes. If it is a female breast, it can be trauma. So just imagine a female, she got an accident. So there is a female, she got an accident, road traffic accident, and during the accident, she has an injury over the breast. The breast is crushed. It is the inflammatory cells in the breast. So it will lead to fat necrosis inside the breast. Or imagine the pancreas. It is having abundant of fat. The pancreas is having infection, inflammation. Acute pancreatitis is there. Have you got it? Or omentum में infection हो सकता है, trauma हो सकता है. These are the causes. Grossly, this is the gross. Can you see the fat? It is abundant of fat. I can't identify the organ. Maybe it is omentum or the female breast. It is fat and fat only. No, either it is omentum or female breast. I don't know. It is the organ, right? Okay. Is it given here? It is mesentery. It is mesentery means omentum. This one is omentum, right? Inside that, can you see these areas? These areas, the yellowish areas. This is all necrotic tissue. This is all. I'm marking जहां जहां पे मुझे दिख रहा है. I can mark the necrosis. This is fat necrosis. Everyone give me a thumbs up. So how does fat necrosis look grossly? It is yellowish deposit. Now, it is the only necrosis. Among the 5 type of necrosis, fat necrosis is the only necrosis in which calcification occurs. In which calcification occurs or saponification occurs. It is known as saponification or calcification. Calcium get deposited over the necrotic tissue. So can you see I have marked the necrotic tissue with blue color. Now inside the necrotic tissue, the calcium will come and get deposited. So it will become calcified necrotic tissue. So if it is calcified, the color is chalky white. Chalky white. So actually, can you see this is all chalky white in appearance? It is all chalky white in appearance because of the calcium deposition, right? So here chalky white appearance is not there. It is pancreas. You can see the two half of the pancreas. Inside the two half of the pancreas, can you appreciate this area, this area, this area, this area? It is yellowish. So of course it is fat necrosis. So that is the gross. That is the gross. Coming on the microscopy. So this is the slide. Now in this slide, I can't identify the normal tissue because normal tissue is not given. In the rest of the three slides, the normal tissue is given. On one side, I tell you the normal tissue. Like in coagulative necrosis, I have shown you the diagram of the kidney. On one side, we have normal kidney. On other side, we have necrotic kidney. At the junction, we have inflammation. In liquefactive necrosis, I have told you brain. On one side, normal brain. On one side, necrotic brain. At the junction, there is an inflammation. In caseous necrosis, I have shown you lymph node. On one side, normal lymph node. On other side, necrotic lymph node. And at the junction, I have shown you the inflammation. Now, this is the diagram of fat necrosis. This is all necrotic tissue. And this is all inflammation. I can't see the normal tissue other way. So I can't identify whether it's a breast, whether it is omentum, or whether it is pancreas. But see the necrotic tissue. The necrotic tissue is looking, how it is looking? It is looking cloudy. The word is cloud. It is looking cloudy. Badal ke jaisa dikh raha hai. Can you see it? It is all cloudy, 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 cloudy appearance. So typically there is a cloudy appearance in the necrotic tissue. The necrotic tissue are adipose cells. That's why they give a cloudy appearance. And inflammation is there, mixed inflammation is there. So in the inflammation, you have abundant of neutrophils, lymphocytes, abundant mixed inflammation is there. That's it. That's it. We are done with fat necrosis also. Now I am coming on the last, that is fibrinoid necrosis. Then we will make a comparative table. You people will help me in making comparative table between them. I am coming on fibrinoid necrosis now. Fibrinoid, the last one, the fibrinoid necrosis. Why it is known as fibrinoid? Tell me the introduction. Why it is known as fibrinoid? It is known as fibrinoid because in this, the necrotic tissue shows fibrin-like material. It is not fibrin. It is fibrin-like. Fibrin nahi hai. Fibrin ke jaisa material hai. That's why known as fibrinoid necrosis. Where does it occurs? In the wall of the blood vessel. We know blood vessel have three layers. What are the three layers of the blood vessel? There is the intima lined by endothelial cells. This is the intima. It is lined by endothelial cells, right? There is a media. This is the media. So we have an intima, we have media, and we have externa. We have intima, media, and externa. These are the three layers in a blood vessel. So where does the fibrinoid necrosis occurs? In fibrinoid necrosis, just a second, in the media, the fibrin-like material get deposited in the media. See this purple color, pink color material I am depositing. So this purple to pink color material in the media, it is fibrin-like material, not fibrin. Fibrin-like material get deposited in the media of the blood vessel. This is known as fibrinoid necrosis. See the diagram from the book. So causes, it is the injury to the vessel wall. It can be vasculitis. Any type of vasculitis will result this. Microscopically, there is no gross. This is microscopy. Can you all see the lumen? This is the lumen of the blood vessel containing blood. And lumen is lined by the endothelial cells. Endothelial cells are normal. There is no problem with the endothelial cell. This is all media. Ye pura media hai. Inside the media, can you appreciate this band, a ribbon-like material, a band or ribbon of pink color? It is fibrin-like material. Have you got it? It is pink area, the circumferential pink area. So that is fibrinoid necrosis. I am done. I am done with the 5 type of necrosis. I am done. You will help me in revising it. You will help me in revising it. First, we will revise the microscopy of all. Microscopy appearance of all. In coagulative necrosis, I have told you the diagram of kidney. On one side, normal kidney. On other side, necrotic kidney at the junction inflammation. In liquefactive necrosis, I have told you the diagram of brain. On one side, normal brain. On other side, necrotic brain at the junction inflammation. Caseous necrosis, I have shown you lymph node. On one side, normal lymph node. On other side, necrotic lymph node, and at the junction inflammation. Inflammation is unique. The junctional inflammation is unique in each of them. Fat necrosis, I have shown you any organ, but only inflammation and that organ. That organ can be omentum, breast or pancreas. I don't know because normal nahi dikhaya. Fibrinoid mein I will show you a diagram of blood vessel. So please, can you identify if in your exam I am giving you this diagram in the form of image based question? Can you identify the type of necrosis? See, this is normal kidney. On this side, this one is the normal kidney. On this side, this is the necrotic kidney. This is necrotic. This is necrotic. Identify the type of necrosis. This is normal. This is necrotic. Can you identify the type of the necrosis? Can anyone of you identify? So you can see in this diagram, here in normal kidney, the outline is there. You can see the architecture that is outlined. You can see the nucleus and you can see the cytoplasm. But here only outline is persisting. The cytoplasm and nuclear details are lost. So of course, it is a case of coagulative necrosis. And at the junction, please appreciate the lymphocytes. Please everyone appreciate the lymphocytes at the junction. Give me a thumbs up. Give me a thumbs up. Have you got it? Yes, Rishinika, of course it is coagulative. The second, can you identify this diagram? Rishinika, can you identify this one? So of course it is a diagram of brain. On one side, I can see normal brain. This is normal brain. You have seen the diagram of normal brain in histology. You can identify it as normal. And this is necrotic brain. This one of the brain is necrotic brain. And at the junction, there is inflammation. Can you identify which type of necrosis is this? Rishinika. Yes. Which type or anyone else? Can you identify? Yes. So these cells are normal. These are the neurons, oligodendrocyte. The background is fibrillary. So it is normal. It is normal brain. But on the other way around, I can't see. Neither I can see the outline. Architectural details are lost. I can't see cytoplasmic detail. I can't see nuclear detail. I can't see anything. I can see only liquid debris. These all are liquefied debris. So of course, it is a case of liquefactive necrosis. It is liquefactive necrosis. It is not coagulative liquid. And at the junction, in the inflammation, we have lymphocytes, we have plasma cells, macrophages, and we have blood capillaries. The blood capillaries are forming the cyst wall containing this liquid. Give me a thumbs up. This is the third diagram. So it is a diagram of lymph node. We can see in this lymph node, this is the normal lymph node. This one is normal. And this one is necrotic. This one is necrotic lymph node. At the junction, we can see the inflammation. We can see the inflammation at the junction. Give me a thumbs up. In the inflammation, we can see a special. No, what is necrotic? Here in normal lymph node, we can see the lymphocytes. The lymphocytes are arranged in follicle. See the architecture, the outline, the nucleus, the cytoplasm of the lymphocyte. But it is converted into necrosis. It is converted into caseous necrosis. I can't see outline. I can't see cytoplasm. I can't see nucleus. I can see only granular amorphous debris. So of course, it is a case of caseous necrosis. It is looking like cheese. At the junction, a special inflammation is there. What is that special inflammation? In special inflammation, we have granuloma. So appreciate the giant cells. Can you appreciate the giant cells here? These are the giant cells. These are the giant cells. These are the giant cells. So these all are the giant cells. Along with giant cells, we have epithelioid cells. These all are epithelioid cells. So this special type of inflammation is seen in caseous necrosis. Give me a thumbs up. This is the fourth necrosis. In this necrosis, I can see a necrotic tissue. Okay. This is all necrotic tissue. And this is the inflammatory tissue. I can't see the normal organ. So I don't know what organ it is. Here I can identify this one is lymph node because normal lymph node is seen. Here I can identify the brain because normal brain is seen. Here I can identify this is kidney because normal kidney is seen. But here normal organ is not given. Only necrotic organ is given, necrotic part and inflammatory part. Uske side pe normal nahi diya. So the necrotic tissue is looking like cloudy. The main word here is cloudy. It is looking cloudy. And inflammation is mixed inflammation is there. So it is fat necrosis. And last but not least, I can see a blood vessel. Can you see a blood vessel? See the lumen of the blood vessel. The lumen of the blood vessel is lined by endothelial cell, which is normal, but that is intima. See the media. In the media, I can see a band, a ribbon or band of a pink color material. That pink color acellular material is fibrin-like. It is not fibrin-like. And that's why it is known as fibrinoid necrosis. Everyone give me a thumbs up. Before launching polls, please help me in making this table. Please, everyone help me in making this table. I want everyone to participate. Okay. So there are 5 types of necrosis, right? So what are the 5 types of necrosis? So coagulative necrosis, liquefactive necrosis, also known as colligative necrosis, caseous necrosis, the third one, fat necrosis, the fourth one, and fibrinoid necrosis, the fifth one. Say yes or no. You have to tell me the definitions first. Definitions of all. पांचों का definition बताइए. In पांचों की definition में what is the difference? Here the cluster of cells are present. These are live cells. These are also live cells. These are also live cells. They have architecture, they have cytoplasm, and they have nucleus. So this live cell, first 3, they are getting converted into necrotic tissue. So in the necrotic tissue, in coagulative necrosis, the architecture is still persisting, but there is no cytoplasm, no nucleus. Here architecture is also lost. Cytoplasm is also lost, nucleus is also lost. Here also architecture, cytoplasm, nucleus is lost. But here the material which is formed is liquid debris, and here the material which is formed is granular amorphous debris. Granular amorphous debris. So tell me the definition of first three. So here architecture detail persists, but cytoplasmic and nuclear details are lost. Here architecture, cytoplasmic, nuclear, all details are lost and everything is converted into a liquid debris. Here architecture, cytoplasmic, nuclear, all details are lost and everything get converted into granular debris. I cannot simplify than this. This is the limits I am crossing. That is the definition of the first three. Let me come on the definition of the fat. Fat necrosis, it is a fat and fibrinoid. These both are special type of necrosis, which occurs in special tissue. Fat necrosis occurs in fat-rich position in the body, fat-rich location in the body. There are three fat-rich location in the human body. That is female breast, pancreas, and omentum. Omentum or mesentery, whatever you say. So here, either trauma or inflammation will lead to fat necrosis. Here, the live cell will convert it into cloudy appearance cell. The cell will die with a cloudy appearance. So here, the word to be taken is cloudy. Cloudy, बादल जैसे दिखेंगे. And fibrinoid necrosis takes place in blood vessel. Only in blood vessel. Blood vessel have three layers: intima, media, externa. So it occurs in the media of blood vessel due to vasculitis in the wall of the blood vessel. In the media, a fibrin-like material get deposited in the form of a ribbon. That's why known as fibrinoid necrosis. So here are the 5 definitions in front of you. I want thumbs up from everyone. If you got these 5 definitions, then only I will go ahead. If you got these 5 definitions, then only I will go ahead. Otherwise, I will not go. So these are the 5 definitions. Have you got the 5 definitions? They are crystal clear in front of you, right? The 5 type of necrosis. Now you tell me the 5 type of necrosis. We have seen coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. We have already seen that. The 5 type of necrosis. The definition part is over. The introduction part is over. In the introduction, we have seen the introduction, that is the definition. Now you tell me the causes of each of them, the gross of each of them, and the microscopy of each of them. So the introduction is over. I'm not repeating the introduction. It is the most common among the 5. And you have done the definition of all of them. We have seen. Causes may. You tell me the causes. So here you tell me 3 causes. Here also you tell me 2 causes. Here you tell me 4 causes. Here 3 causes. Here 1 cause. Who will tell me the causes? Okay. Let me start with coagulative. It is ischemia of all organ except brain. And in liquefactive, it is ischemia of brain. So पहले तो ischemia खत्म करो. Ischemia of all organs are coming in example of coagulative except brain. Ischemia of brain is an example of liquefactive necrosis. That is the first thing. The second thing is thermal injury, and third thing is Zanker's degeneration. In liquefactive, it is pyogenic infection, pyogenic bacterial infection. In caseous necrosis, there are 2 bacteria and 2 fungus. The 2 bacteria are TB. Of course, yes, Rishnika, it is TB. Yes, Ansh. So TB and second is syphilis. What are the 2 fungus? It is histoplasma and coccidiomycosis. So that are the 4 causes. In fat necrosis, what are the 3 organs? It is breast, pancreas, omentum or mesentery, the 3 fat-rich organ in human body. Either trauma of these organs or inflammation of these organs. That will lead to fat necrosis. And in fibrinoid necrosis, only 1 organ is there, that is blood vessel. Blood vessel ka hoga vasculitis. Vasculitis of the blood vessel. So that is the causes. We are done with the causes. Something important in the gross. If that is important, then only you tell me. In gross, here the organ is pale, yellow, swollen. Here the organ is converted into a liquid cavity lined by a cyst wall. Here the organ look like cheese. Here the organ look like calcified deposits which look like chalky white appearance. The word to be taken here is chalky white. And fibrinoid may no important gross appearance. Microscopy diagrams I have already shown you, the 5. Everyone give me a thumbs up. I am done with the 5 type of necrosis. I want you to write your answer in the comment box for the polls. So this is the first question in front of you. Ansh, what is the answer? Rishinika, what is the answer? Anyone else listening to me? What is the answer? Dr. Logical? Or what is the name of the other student who are watching my lecture live? So please write down what is your answer. Necrosis with cell bodies retained as ghost cell. That necrosis is known as. So that necrosis is known as coagulative necrosis or liquefactive necrosis or caseous necrosis or none. What is your answer? I'm asking for the ghost cell. I'm asking, Rishinika, you are absolutely right. The ghost cell is seen in coagulative necrosis. I hope you understand the meaning of the ghost cell. In coagulative necrosis, only outline persists. Cytoplasmic and nuclear details are lost. So it is known as ghost. Ghost का मतलब होता है भूत. Ghost का मतलब होता है भूत. भूत की भी सिर्फ outline होती है ना. There are no details inside the भूत. That's why it is known as ghost cell, or that's why it is known as tombstone appearance. Very good. The correct answer is A. Very good. This is the next question in front of you. All of the following organs likely to show coagulative necrosis except coagulative necrosis never occur of which organ? Which of the following organ never show coagulative necrosis? Yes, Srishinika, spleen, heart, kidney, or brain. Which organ never show coagulative necrosis? What is your answer? This is an easy one. Come on. What is the answer here? Yes, very good. The correct answer here is brain. In brain, coagulative necrosis never occurs. In brain, liquefactive necrosis occurs. So ischemia of all organs leads to coagulative necrosis, but ischemia of brain leads to liquefactive necrosis. Yes, the correct answer is D, Rishinika. You are absolutely right. This is the next question in front of you. The other way around, we can ask the same question in this way. So liquefactive necrosis is seen in ischemia of which organ? Liquefactive necrosis is seen in ischemia of heart, or ischemia of brain, ischemia of lungs, or ischemia of spleen. So everyone, yes, Ansh, Rishinika, both of you are right. Here also you already know the answer. So what is the answer here? Of course, the other way around, I'm asking the same question. So answer is brain. So in the last question I have asked, coagulative necrosis is not seen in. The answer is brain. Here I have asked, the liquefactive necrosis is seen in. So answer is brain. Yes, very good. The correct answer here is brain. Both of you are right. So I am done with necrosis. The various types of necrosis is done. Now, the last topic, the next 10 minutes. You please give me more 10 minutes. I will cover gangrene also. So gangrene is a specialized form of necrosis. Now, what is the difference between gangrene and necrosis? So what is necrosis? What is necrosis? I have already told you what is necrosis. Necrosis is cell death. The cell is dead. The cell is dead by one of the 5 type of necrosis. You know the 5 type of necrosis, the cell is dead. Now you know whenever any cell is dead, bacteria got attracted towards the dead cell. Bacteria got attracted towards the dead material. Whenever anything, so if you see dead bodies, they are not kept in cold. So the dead bodies get putrefied very fast. So it smells, right? Because of the putrefaction by the bacteria. So in the body is live. This is human body, is live. The person is not dead. The person is live. But one of the organ inside the human body, any organ, a portion of the organ is showing necrosis. Just suppose liver, lungs, kidney, any portion. A small portion is showing necrosis. So bacteria will get attracted towards that necrotic portion. Bacteria will go in that necrotic portion because it is the dead region. And bacteria will cause putrefaction. Bacteria will cause putrefaction. You know the meaning of putrefaction in Hindi? हिंदी में उसको बोलते हैं सड़ना. बैक्टीरिया उसको सड़ा देगा. So putrefaction of that dead portion, right? This is known as gangrene. So in short, gangrene is nothing. Gangrene is equal to necrosis plus putrefaction. Necrosis, the necrotic tissue is attracted by the bacteria, and bacteria will cause the putrefaction, and the putrefied necrotic tissue is known as gangrene. Give me a thumbs up. I cannot explain more than this. So the putrefied, what is the definition of gangrene? I will come on the types of the gangrene. So what is the definition? It is the necrotic tissue which is having superadded putrefaction. So necrotic tissue along with superadded putrefaction by the bacteria, it is known as gangrene. So N plus P is equal to G. Give me a thumbs up. Ansh, Rishinika, everyone give me a thumbs up. Everyone, that is gangrene. So Alicia, what you are asking? Tuberculosis pathology. Alicia, I have already having a class, a free class of tubercular pathology, not on YouTube, on Unacademy free classes. If you want me to share the link, kindly tag me on the Telegram. Alicia, kindly tag me on the Telegram. I will send you the link of TB. The entire TB I have taken in an integrated manner. Integrated manner में मैंने पूरा TB लिया है, in which I have covered TB from 4 subjects. In that series, there are 3-4 episodes. So I have covered entire TB from pathology. I have covered entire TB from microbiology. I have covered entire TB from medicine, and I have covered the treatment of the TB, that is DOTS, from the pharmacology, right? So it is an integrated series. The links are available. The classes are free. Don't worry. You can watch it for free. The only thing you require a code to unlock it. I will provide you the code also. Tag me on the Telegram if you want the links, right? Or you can search the links directly on the Telegram, the special classes. The code already, you know, the code is my surname, Sachdev10, SSCHDEV. You can unlock any free class using this code. So please help me in distributing this code to all medicos throughout the world. The code is SACHDEV, Sachdev10. Thank you very much. Should I proceed ahead? Okay. So I have told you the definition of gangrene. So gangrene is nothing. It is the necrotic tissue which got putrefied by the bacteria. So bacteria is causing putrefaction of the necrotic tissue, and the putrefied necrotic tissue is known as gangrene. Give me a thumbs up. That is the definition of gangrene. After definition, so here it is written. Gangrene is equal to necrosis plus putrefaction. G is equal to N plus P. We got it. We got it. Right. Okay, we got it. Let me move ahead. What are the types of gangrene? There are three types of gangrene. What are the three types of gangrene? Dry gangrene, wet gangrene, and gas gangrene. So I will explain you all three gangrenes one by one. Let me start with dry gangrene. So dry gangrene. Okay, listen. What is the basic difference in dry and wet? What is the basic difference in dry and wet? Okay. Let me form an organ here. This is the organ. Just suppose it is a liver or any organ. So this portion is necrotic. This portion is necrotic, right? So if few bacteria are coming, mind my words, if few bacteria are coming, so they will cause the putrefaction here, but it will be very less because the amount of the bacteria, the number of the bacteria is few. So organ, it is necrosis with a minute putrefaction, and the organ will remain dry only. It will be black and dry. So that's why known as dry gangrene. But imagine a situation when abundant, many bacteria will come here together. All the bacteria, there are abundant of bacteria, many bacteria, they will cause abundant of putrefaction, and the because of the putrefaction ye pura sad jayega and it will convert into a liquid material. That's why it is known as wet gangrene. That's why it is known as wet gangrene. So what are the two type of gangrene? Dry and wet. I will come on gas gangrene. Gas gangrene means the bacteria will be a gas forming bacteria. I will tell you. So let me teach you dry gangrene. In dry gangrene, it is not no bacteria, it is few. Few मतलब almost no. बहुत कम bacteria होंगे. बहुत कम होगा तो organ is dry. That's why the organ is dry. And in wet gangrene, the bacteria is super infected. Many abundant bacteria are present. That's why the organ is wet and liquefied. The organ is wet and liquefied. Give me a thumbs up. Give me a thumbs up. So let me teach you the dry gangrene. Dry gangrene usually occurs in distal part of a limb. Can you see this is the limb? So distal part of the limb, either the foot or the hand. So limbs में होता है ये. Distal part of the limbs. Number one, it occurs due to the ischemia of artery. So if the artery is blocked, the person will have coagulative necrosis. Just suppose this is the foot. Just a second. Just suppose this is the foot of a person. This is the foot of a person and this is the artery of the foot. If the artery of the foot is blocked, this is the artery supplying to the foot, right? You know the which artery is supplying. So if the artery is blocked, that is the person is having ischemia of the foot. So this tissue will undergo dead by coagulative necrosis because it is not receiving blood. So coagulative, we know out of the 5 necrosis, coagulative necrosis will occur here and few bacteria will come that will cause minute putrefaction and it is known as dry gangrene. So this organ will undergo gangrenous and it will look black in color, right? Can you see this is black color? It is gangrenous. This is black color. It is gangrenous because of ischemia. Ischemia of the artery it occurs. It occurs in a limb. It occurs due to ischemia, that is blockage of the artery. Blockage of the artery. It develops very slowly upwards. So it starts from downwards and very slowly it is going upward, but very slowly, very slowly. Give me a thumbs up. And the last thing, you can clearly see a line of separation between the live tissue and the dead tissue. Can you make out a line? Yes, you can make out a line here. This is the line of separation. So this is live tissue, this is dead tissue. So a clear line of separation is present, which is separating the gangrenous part from the viable part. So these are the 4 points you have to learn. And here it is coagulative necrosis. It is coagulative. The dead tissue is present, but it is not digested and removed by the bacteria. It is not mummified. It remains mummified, but it is not digested because bacteria are few. Now let me come on the wet gangrene. The second, here the organ, now let me finish dry first. Here the organ is dry. Because it is dry gangrene, the organ is dry, dark black in color. Dark black. Can you see it? It is dark black. The organ is dark black and dry in color. It looks like mummy. It is not mother wala mummy. You know mummies. It looks like a mummy. Mummies. So it is mummified. It is mummified, right? So the organ look like a mummified. That is, it is putrefied. It is putrefied and it is black in color. We can see a line of separation. That is the gross. See, this is the live diagram. Can you see this is gangrenous foot? Can you make out a line of separation? Yes, this is the line of separation. It is slowly growing upward. Slowly. So we can make out the line of separation between the, this is viable tissue, this is viable tissue, this is dead tissue. It is due to the blockage of the artery. And the organ is dry and it is black. It is looking like a mummy's foot. Give me a thumbs up. Give me a thumbs up. So these are the diagrams. Histologically, it will show coagulative necrosis. Coming on the wet gangrene. The second gangrene is the wet gangrene. Here, bacterial infection is superimposed. Abundant of bacteria are present. So abundant of bacteria will digest the dead tissue. The dead tissue is digested and they convert the dead tissue into liquid necrosis. So it is basically a coagulative necrosis which got converted into liquefactive necrosis. Have you got it? The first one, dry gangrene, was usually occurring in limbs. The second one, the wet gangrene, usually occurs in moist organ. What are the moist organs in human body? It is bowel. Bowel is moist because of juices, the digestive juices, lungs, mouth, cervix, vulva, the genital organs. So all moist organs can have this type of gangrene. It is not in the limbs. It is not in the limbs. Have you got it? It is due to the blockage of both artery and vein. Have you got it? I have told you the dry gangrene. The dry gangrene is due to the blockage of the artery. It is due to the blockage of artery as well as vein. The dry gangrene was developing slowly. The wet gangrene develops very rapidly. In dry gangrene, there is a clear-cut line of demarcation which separates the viable tissue from the gangrenous tissue. Here, there is no clear-cut line. Can you see an intestine? Okay, if I cut open this intestine, this is the diagram. See the diagram of the intestine. Now, in this diagram of the intestine, can you make it out? Where is the gangrenous portion? Yeah, I can make it out somewhat vague. It is there, but I cannot make a clear line. What is the gangrenous tissue, right? So it is wet. It is developing rapidly. There is no line of demarcation. Give me a thumbs up. There is no line of demarcation. So yes, so gangrene of the bowel commonly due to strangulated hernia. Diabetic foot is an example of wet gangrene. In diabetes, you know, gangrene is very common. So it is an example of wet gangrene. It is very important question which is asked commonly. So here the organ is soft, swollen, putrid, rotten and dark. It is also black color. It is soft, rotten, dark color. Right. Now listen, the differences are very ultra important. Very important. Many MCQs will come from these differences. There are two types of gangrene, dry and wet. I'm coming on gas gangrene. First understand dry and wet gangrene. So there are two types of gangrene, dry gangrene and wet gangrene. Please understand. Dry gangrene basically occurs in the foot, in the limbs, and wet basically occurs in the bowel. It can occur at any moist region, but most commonly bowel. So that is the site. ये दोनों की site हो गई, right? Mechanism. Dry gangrene basically occurs due to artery का occlusion. Wet gangrene occurs due to both, occlusion of both, artery plus vein, occlusion of both. Give me a thumbs up. Grossly, tell me the gross. Here the organ is dry, here the organ is wet. Here it is shrunken and black. Here also it is black, but it is wet. So that is the gross. Putrefaction is very less here, limited. Putrefaction is marked here. Bacteria are less here. Bacteria are numerous there. Have you got it? Line of demarcation. The line of demarcation, it is present in dry gangrene. You can separate the healthy part with the gangrenous part. Here, no clear-cut line of demarcation. You cannot separate which is viable part, which is gangrenous part. Give me a thumbs up. Everyone give me a thumbs up. So these are the differences you must understand. Now, the summary. Dry gangrene, it is a variant of coagulative necrosis. So the organ is having coagulative necrosis with little bit putrefaction. Little bit, mild putrefaction because bacteria are less. So that is known as dry gangrene. But in wet gangrene, it is coagulative necrosis only initially. But abundant of bacteria causes abundant of putrefaction. So the organ get converted into liquid. So it is liquefactive necrosis superimposed on coagulative necrosis. Have you got it? So dry gangrene and wet gangrene. Tell me the type of necrosis. You know the 5 type of necrosis now. What are the 5 type of necrosis? Coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis. So which necrosis leads to which type of gangrene? You know gangrene is equal to necrosis plus putrefaction. So which necrosis is present here? Which necrosis is present here? Tell the type of necrosis. Here only coagulative necrosis is present. Here coagulative necrosis is superimposed. It is superimposed by liquefactive necrosis. So that is the summary. I cannot simplify more than this. In dry gangrene, we have only coagulative necrosis. In wet gangrene, along with coagulative necrosis, there is superimposed liquefactive necrosis. Here bacteria are few, so putrefaction is limited. It is very limited putrefaction. Here bacteria are abundant high, so putrefaction is too much and the entire dead tissue is liquefied. That's why liquefactive necrosis is superimposing the coagulative necrosis. Yes, you all are right. Have you got it? Now the third variant is the gas gangrene. As I have told you, the third variant is the gas gangrene. Right. Now, if gas forming bacteria is coming to the dead tissue, the necrotic tissue, the bacteria has to come now. Which bacteria is coming? Gas forming bacteria. Which is a gas forming bacteria? It is Clostridium. So if the bacteria is Clostridium, it will form gas. Okay. See, this is the tissue. Can you see? It is a road traffic accident case. In the road traffic accident case, the entire calf muscle here, all the thigh muscles here, they got necrotic. The muscle is dead. The muscle is dead, absolutely dead. Now in the dead muscle, now it is a road traffic accident. No, so patient fall in the soil at the time of accident. At the time of the accident, the patient fall in the soil. In the soil, the spores of Clostridium are present. We know the spores of Clostridium are present in the soil. They entered in the tissue from the soil. So Clostridium spores will grow out and bacteria will develop. Now this bacteria forms gas. So it is the gas bubbles we can see. So it is a gas gangrene. So the tissue is gangrenous, but we can see the gas. So it is known as crepitant. You know the word crepitant? Crepitant is anything which is having gas inside it. So the necrotic tissue become crepitant. It is like lung. If you feel it, the consistency is like lung because it is having air. It is not liquid inside them. These are not vesicles. Vesicle is a term which is liquid filled cavity. It is not vesicle. It is crepitant. It is a gas filled cavity. If you can puncture it, it is containing gas. So gas is formed by the Clostridia. Give me a thumbs up. Give me a thumbs up. So here, what is actually happening? You tell me what is happening. So a gas forming bacteria, that is Clostridia, is entering. It enters in the body through open contaminated wounds. The wounds are contaminated from the soil or from the operation, in the surgery if the instruments are not sterilized. The organ becomes swollen, edematous, painful, and crepitant. Crepitant means containing gas inside it. You can see the gas is present. You can see the gas. It is a gas containing crepitant. Crepitant. It is gas containing cavity. So the gas is formed by gas forming bacteria, that is Clostridium. Clostridium. The only treatment, it is a dead tissue, no? You cannot make dead tissue again alive. This tissue cannot make alive. The only treatment is amputation. You have to lose the leg of the patient, right? So it is something serious, right? The patient has to lose the limb. So amputation is the only treatment here, right? So it is dangerous. The dead tissue is there. We cannot make it alive, right? So thank you very much. I have completed the necrosis as well as gangrene. Do you have any doubt in this? Now, if you want the notes of my entire series, not only this lecture, if you want any notes, so notes are available on the app, on the Unacademy app. So thank you for being with me. Thank you very much for being with me. I really enjoyed teaching you. Hopefully, see link along with my name. Just a second. The video is stuck. And you have to follow that profile link. Once you follow that profile link, you will get a list of recordings. You will get a list. More than 500 recordings are available free. These are the list of free special classes. Free. So various subjects, pathology, pharmacology, microbiology, medicine, PSM. I have taken free lectures of multiple subjects. So many notes along, and you can download the notes PDF also. So you can watch any of the 500 free recordings there, right? The only thing you will require a code to unlock it. So I'm providing you the code. The code is my surname, Sachdev, Sachdev. Sachdev 10 is the code to unlock any free recording. You cannot unlock the plus recording, the paid one, but the free one you can unlock using this code. I request you to please distribute this code to all the medicos throughout the world, throughout the globe, so that everyone get the benefit of the free education or free knowledge. Thank you very much for being with me. Unacademy is offering some new offerings to the NEET PG category. Now on, if you take the Unacademy app, the paid version, you will get previous year questions available on the app and you can do the practice. Previous year question of NEET PG, FMG, INICT. 3-year papers are available with detailed discussion, right? Extensive doubt clearing batches there. If you have slightest doubt in any of the 19 subjects, you can ask to the educator will answer it. So you can take the subscription and get the benefit of this batch, right? Practice test after every plus class. After every plus class, we will give you 5 to 10 bunch of questions to practice so that topic by topic, your topic will become strong. So there is previous year question bank available, doubt clarification bank coming from the next month, and daily practice. We will give you 5 to 10 MCQs after every topic, right? This is the free test calendar for the March. On 30th and 31st, both March, we are having a test at 7 p.m. and 4 p.m. I request you to give this test. It is a free test. It is a free test. You can use my code to give the test. It is a free test and see your rank, all India rank, right? And if you want the test series of Unacademy, so you can take only test series also. Don't take the complete subscription. You can take the test series also. Subject-wise test series, system-wise test series, full-length mock test question paper, previous year test series curated by the top educator. Everything is available on the app, right? Now, the biggest announcement is that for the last 3 days of the month, that is 28, 29, 30th, and 31st March, till 31st March, till 31st March. The 2 days are left, today and tomorrow. Tomorrow, 12 a.m. in the night, we are having this offer. If you take any subscription, any plan, instead of 10% discount, you will get 20% discount. If you use my code is same, that is Sachdev10, SACHDEV, Sachdev10. So I request all my dear students, if you are planning to take subscription in future, take it today and tomorrow using this code. You will not get this opportunity again. So instead, if you normally take subscription, you will get 10% discount. But now if you take subscription today and tomorrow, you will get 20% discount on all plus plan, on all iconic plan. Minimum is 2 months, maximum is 4 years. So thank you very much for being with me. Once you take the subscription, you will be eligible. In plus, you know the difference now. In plus, you will get only Unacademy access. In iconic, along with Unacademy, you will get prep ladder also. So once you take the subscription, you will be eligible for all these batches by the topmost educators of India. Thank you very much for being with me. I'm having 2 more lectures today. The next lecture will be in the evening. The heading of the next lecture, what I'm going to teach you is edema. Edema in hemodynamics, after that thrombosis in hemodynamic, then embolism in hemodynamics, embolism, and CVC, chronic venous congestion. So these are the topics which I am going to teach you today, evening and night. So stay connected on YouTube. Only all these free classes are available. So thank you very much. Stay connected. Bye-bye. Study hard and all the best. I'm ending this lecture.